what we call 3-year plans. Yeah. And so we are now in the final year. Our year runs from July to June. And so we are in the last year. In July we started the last year of this 3-year plan.
Okay.
And in this 3-year plan we introduced a new initiative called Healthy Communities. And the idea behind Healthy Communities is that it's a very broad approach to health and how it impacts on all of community development. So it's not sort of medical and individual health as much as it is community health and the overall health of the community. So it resonates strongly with areas that might not necessarily immediately be thought of as health concerns. And it certainly is an environment for issues like maternal and child health care and AIDS and HIV, which are not exclusively medical issues at all. In fact, a lot of it is outside of it, just exactly the social. So we've taken quite a specific approach of looking at this issue of healthy communities and looking at community media and thinking about how can we support community media in conjunction with other stakeholders in the communities to deliver better programming about priority local issues. And what we've tried to do is to elaborate with different partners that we've worked with around the Commonwealth, here in Africa, in the Caribbean, in Asia, and in the Pacific, is together by actually working at a community level to elaborate a kind of model for effective programming and program development strategies. And that's really been our main focus, is how can communities come together to actually develop programs that will be educational in nature or learning in their focus and in their objectives. How can they develop those programs and how can they make them effective? I mean, essentially what we're trying to do is to apply the principles of open and distance learning, which is that by introducing technology into education you can reach much, much larger numbers of people, but keep the costs low and keep the quality high, and in fact maybe even improve the quality and change some of the dynamics about the way the education is delivered by making it more learner-centered. So we've really taken those guiding principles and applied them in this area of health education and development education. And thinking about the fact that the same applies really, that the needs for learning about any of these issues that would be of importance to a community are much higher than the capacity of either the public or the civil society groups to be able to deliver that. And therefore, logically, communication and vehicles like community media will be of service in terms of taking that education out to a much larger audience, keeping the costs low, and also maintaining quality and introducing some new elements. So some of the things that we've identified as being those kind of guiding principles are collaboration. That the programs really have to be a collaboration, not just between the media, but between experts, whether they are in the public sector, the civil society sector, community groups, networks and associations that actually mobilize the population, as well as policy groups. So it's that kind of 4-part collaboration of different groups that our analysis to date has pointed out that those really are the success factors, that if you have the involvement of those groups, that's the kind of collaborative framework that you need. Now the programs could be led by the media, the programs could also be led by groups in the public or in the civil society sector, but working with the media, and it depends on the local context. I mean, one of the sort of leading sort of principles there is that the programs are local. So we're really looking at programs that are happening at a district level, or whatever the equivalent of a district would be in the territory. So it could be a parish, it could be something else. The reason being that one of the other ideas is that they have to be participatory. In other words, you have to find some way to get to the target learners actually involved in the program from the very beginning, making decisions about the program, and ideally taking some degree of ownership over that program because they feel as though it is really for them. And so being local allows the programs to focus on local priority issues that the communities decide themselves, and also to make sure that those people are actually involved in making decisions about the program. And we've come up with different strategies as to how groups can actually do that. For example, by having really sort of a design workshop or a design process where you call all of those different stakeholders together, and over the course of a week you actually go through and design the program during that week And you have to make sure that all of those groups, the community groups, the experts, the media, and the policy representatives are all involved at some level, so that you have a program that essentially is endorsed by everybody and that everybody's involved with. And perhaps most importantly, that you've got those target learners and target communities involved in making all of the decisions about the program, from what messages, what topics, what formats will be used, the name of the program, all those things. And at the end of the week, you've delivered a design for a program that could be 3 months or 6 months that has very specific learning objectives, that they have in the same time produced at least one pilot of the program over the course of that week. So they've designed the program for a much longer period, but they've gone through all of the different steps that are required to actually produce one program. So any of the skills that are required to produce one program, they've had some hands-on training over the course of that week to be able to do it. The programs are then mentored somehow afterwards so that they can continue to produce those kind of programs. So that really has been the focus of our work over the last couple of years, is how do we refine that model in terms of talking about collaboration, participation, and the fact that the programs should be what we call blended. So borrowing a term from open and distance learning, it's not just education using the media or the radio, it's also combined with some kind of face-to-face reinforcement of those messages, or the radio may reinforce messages that are happening in face-to-face, which comes back to the idea of collaboration, that you have to have those development groups, whether it's on the public side or on the civil society side, involved in order that you can run a program that will support the existing work that's happening in terms of mobilization or in terms of awareness that's happening face-to-face. So that's why we call it a blended approach. So that has been our focus, is on developing that model, building the capacity of groups at a national level, and those groups therefore to be able to build capacities at a local level, to be able to use this kind of a model and this kind of an approach to programming. There's nothing there that is, radically new or completely different, but what we're trying to do is to make it accessible to people in a way that they'll actually be able to act on it, and that we'll see a fairly widespread replication of those kind of programs by introducing this kind of an approach, which we think is low cost and fairly simple to use. So with the collaboration of Cameroon Link, we actually did a demonstration project over the course of the last year with Lebialem Community Radio, and the program is about maternal and child health. So tomorrow we will go and we will do some kind of an evaluation of that program with the people who've been doing the program, to see what kind of changes they perceive in terms of the way the programs are produced, the kind of relationships that there are between the different stakeholders, the kind of participation that this kind of an approach has enabled. Is it different than the kinds of programs they were doing before? And to brainstorm ideas about how they will sustain this kind of a program into the future. So the reason we did that was to give us, in a sense, something to talk about here and to explore the possibilities here in Cameroon. The sort of next steps that we see are doing some kind of a survey of the different community radio groups to assess what kind of health programs are they running now, and in what ways do they do those programs, and in what ways might this type of an approach be able to add some value to the work that they are already doing in the area of health.